Hello friends, welcome to Creative Medicine. In this lecture, we will learn about ventricles of the brain are lined by ependymocytes. Ependymocytes are cuboidal or columnar in nature with tufts of cilia lining the ventricles of the brain. Anterior horn of lateral ventricle is closed anteriorly by corpus callosum. Anterior horn of the lateral ventricle is closed anteriorly by corpus callosum. Anterior ventricle is connected to the third ventricle by foramen of Monro, whereas fourth ventricle to the subarachnoid space is foramen of Lashka and foramen of Magendie. Pineal glands will form the posterior wall of the third ventricle. Pineal gland forms the posterior wall of the third ventricle. Floor of the third ventricle is formed by tuber cinereum, posterior perforated substance, and the tegmentum. And here it is pituitary stalk forms the floor of the third ventricle. It is not anterior pituitary. So this is false. Next. Foramen of Magendie is a central opening of the fourth ventricle into the subarachnoid space. All are seen in the floor of the third ventricle except in the floor of the third ventricle you will see infundibulum, mammillary body, and optic chiasma. You will not see oculomotor nerve in the floor of the third ventricle. All are seen in the floor of the fourth ventricle except in the floor of the fourth ventricle you will see vagal triangle, hypoglossal triangle, and vestibular area. Stria terminalis is not seen in the floor of the third ventricle. Actually, abducent nerve, vestibular nerve, vagus, and hypoglossal nuclei are present in the floor of the fourth ventricle. So all these nerve nuclei are present in the floor of the fourth ventricle. Floor of the fourth ventricle has vagal triangle, whereas infundibulum, mammillary body, and tuber cinereum are present in the third ventricle, not fourth ventricle. Floor of the fourth ventricle contains all except it contains abducent nucleus, hypoglossal nucleus, and dorsal vagal nucleus. It does not contain facial nucleus. It has facial colliculus is seen, which is due to the abducent nucleus. Facial colliculus is located at pons. Which cranial nerve nucleus lies under the facial colliculus? Sixth cranial nerve. Abducent nerve nucleus lies under the facial colliculus. The diagram of fourth ventricle is given with facial colliculus marked. Damage to the structure producing the elevation may lead to the paralysis of which of the following? The elevation is produced due to the abducent nerve. So it is produced due to the abducent nerve. So it is LR4 SO4 LR6. So abducent nerve will supply the lateral rectus. So the problem here is in the lateral rectus. Okay. Remove the previous one and upload this again. Thank you, and thank you for watching.